Hey, today we're covering a story that could change cervical cancer screening for millions of women. Change cervical cancer screening. If you've ever dreaded a pap smear, you're not alone. For some, these exams can be uncomfortable, and for others, even triggering due to past trauma. But there's good news on the horizon. A growing number of experts now recommend HPV testing as a safe, effective alternative. HPV, or the human papillomavirus, is the virus responsible for most cases of cervical cancer. Most of us are exposed at some point, but usually our immune systems handle it. It's only when high-risk strains persist that the risk of cervical cancer rises. Traditionally, a pap smear involves a clinician collecting cells from your cervix using a speculum and a small brush. But HPV testing can now be done using a self-swab. Yes, patients can collect their own sample from home or even in a clinic restroom. According to Dr. Rebecca Perkins at Tufts Medical Center, HPV testing detects 90 to 95% of precancerous abnormalities, compared to 70 to 80% for pap smears. That makes it not only a more comfortable option, but a more accurate one. New guidelines from the American Cancer Society now recognize vaginal self-swabs as a valid form of cervical cancer screening. They recommend testing for anyone with the cervix between the ages of 25 and 65. If a clinician collects the sample, it's every 5 years. If you do it yourself, it's every 3 years. However, there are some limitations. Right now, the only at-home HPV test approved by the FDA is available through Teal Health, a telehealth company. It costs about $99 plus insurance, and most traditional clinics do not yet offer self-swabs for home use. Transportation and sample stability are also considerations. A sample mailed in extreme temperatures could affect the accuracy, which is why in-office self-swabs remain more reliable. But even in that setting, many women prefer it to the traditional speculum exam. It's quicker, less invasive, and gives you the control. Insurance coverage is always a challenge. Because HPV-only self-swabs aren't yet recommended by the U.S. Preventative Service Task Force, many plans still won't cover them. Experts expect the guidelines to change eventually, making this option more accessible. It should be more accessible. Older women, who often see gynecologists less frequently, could especially benefit. Simplified HPV testing can help catch cervical cancer earlier when it's most treatable. So if you hate pap smears but still want peace of mind, talk to your healthcare provider about HPV self-testing and the self-swab option. It's safe, effective, and could make cervical cancer screening easier for millions of people. Well, that's it for today's update on cervical cancer screening alternatives. I'm Vic Senese with UroNurse, keeping you informed, empowered, and in control of your health. Hey, tomorrow on UroNurse News, I'm going to share 8 simple tips to lose 10 pounds in just 2 weeks. 8 tips, 10 pounds, 2 weeks. Safe, practical, and easy to start today. Don't miss these expert insights to kickstart your weight loss journey this year. So tune in tomorrow to take that first step towards a healthier you. Saturday on UroPatient, men, it's time to get the facts. We're diving into how an erection works and what every man should know. Join me as I break down the science behind erections, what affects them, and why understanding your body is key to sexual health and confidence. So whether you're curious, concerned, or just want to learn something new about your own health, this episode is for you. So Saturday, 10:30 a.m. at UroPatient.com. Don't miss it. I'm Vic Senese. This is UroNurse News.
UroNurse News, where science meets care. Clear, credible, always fair. From prostate health to patient views, your trusted source, UroNurse News.